I think it's easiest to understand the social entrepreneur through an example, and so I will provide one that that doesn't immediately come to mind for folks. Bill Foege. Bill Foege was a medical doctor and epidemiologist working for the CDC when the World Health Organization and the Congress of Nations came together to eradicate smallpox. He was on the front lines in Africa, part of this coalition, an enormous public-private partnership that had determined they would vaccinate everybody in the world. And he realized as he was trying to carry out this mandate just how vast it would be, and the goal seemed to get farther and farther away. And so he came up with an idea to really test whether you could vaccinate only those who had been exposed to smallpox. And so he put a network that was readily to hand, and these were ministers working throughout Nigeria. He put that network to work in identifying active cases of smallpox, and then proceeded to vaccinate only those who had been exposed to the disease. And in those villages, smallpox receded. And so, armed with that information, he was able to bring that model to these partners in the WHO working all over the world, and that was the solution. And it was that innovation, and it was that very resourceful way of addressing a problem at this level that led to the eradication of this horrific disease, the first disease to be eradicated in the history of the world. And people don't think of Bill Foege as a social entrepreneur, but that solution and that experiment and its success in shifting that equilibrium forever, that is to me quintessential social entrepreneurship.